I'm Tammie Brailsford, and in 40-plus years in healthcare, from bedside nursing to executive leadership, there's never been a more challenging time than the COVID-19 pandemic. This past year has profoundly impacted our patients, our organizations, and our healthcare teams. So if you're bone weary and hoping for some long-needed relief, you're not alone. And at the same time, if you're proud of the work of your team, you're not alone either. The question now is, how do we lead well and carry on? How do we learn from the life-changing experience we've all powered through over the past year? And how do intentional leaders, like you, forge a vision, find the right pace, and help our teams take the next steps? Earlier in the pandemic, I described how delivering healthcare during a pandemic is like hiking at altitude. A hike of just a few hundred feet at altitude, something that felt easy at sea level, leaves you breathless, exhausted, and overwhelmed. And right now, we're still on COVID Mountain. A day of caring for patients during a pandemic, it's harder, more stressful, and more demanding than it was on any normal pre-pandemic day. But as the emergency phase of the pandemic recedes, it can be tempting to think, or hope, that we can all go back to normal immediately. But as every experienced hiker knows, climbing up the mountain is only half the journey. Going down COVID Mountain, that's tough too. It's just a different kind of tough. We reached the peak of infection rates, and now many regions in the U.S. are seeing a steady decline in the number of critical patients in our ICUs. In some cases, we have no hospitalized COVID patients at all, and that's great news. We've been hoping and working for this moment, but getting your team safely down the other side of COVID Mountain is just as important as navigating the peak of the crisis. In an earlier video, I conveyed how leaders who focus on well-being and relationships help make a challenging climb less steep for everyone. Today, I want to introduce a third essential element: intentionality. We need to be intentional about the well-being of our teams and our own well-being in order to lead well. As an intentional leader, you ask yourself, what do I need to do? How do I want to be? And how do I want people to feel? It's about connecting with your purpose as a leader, and right now, I believe our purpose as healthcare leaders is to attend to the immediate needs of the people we lead, while managing the very real financial and other long-term needs of our organizations. People first, issues second. Intentional leaders move purposefully and persistently from person to person, not issue to issue. We take responsibility for consciously evolving ourselves, our team, and for getting buy-in to launch systemic changes. We create a vision of where we want to go and about how we want to be on that journey. Now, as we navigate the path down COVID Mountain, we need to commit to being very intentional. Rather than manage the status quo, rather than race to the bottom, how can you intentionally lead your team through the next critical phase of the pandemic? To answer that question, let's take a look at the challenges we can anticipate as we move from the emergency phase into the recovery phase. First, we know that the financial impacts of the pandemic on health systems, they're significant, and they're starting to hit home. Financial analysts predict the 2021 impacts of COVID on U.S. healthcare will be as much as $122 billion in lost revenues. Even with the support of federal COVID relief funds, many hospitals have negative operating margins. Patients have deferred care, hundreds of thousands of people have lost jobs and their health insurance. And all of this is shining a very bright light on the growing disparities in access to health care. At the same time as these financial and societal pressures come to bear, our healthcare teams, they're exhausted. Many of our routines have been challenged and relationships have been strained. Some employee groups and local communities, they feel disenfranchised and distrustful. We've lost many colleagues during the pandemic, some to the virus, and others are just burnt out. According to the Kaiser Family Foundation, 62% of frontline healthcare workers say that worry and stress have affected their mental health. 49% say the pandemic has affected their physical health. And alcohol and drug use, it's increased by 16%. And yet, only 3 in 10 healthcare workers have reached out for help from mental health resources. Intentional leaders know these numbers. Intentional leaders, they stay close. You take a keen interest in the emotional well-being of your employees, and you help them connect with resources, with compassion, respect, and a genuine concern for their well-being. With all these pressures stacking up, and after months of running on adrenaline and fear, how do we recalibrate and resist the temptation just to move on to the next crisis? This situation calls for very intentional leadership. Stop. Pause. Take a breath. It's essential to address the human toll that the pandemic has taken on our teams and on our organizational cultures. As healers, we need to recognize the personal, team, and cultural impacts of the collective trauma we've navigated. Over the past year, our frontline teams have had no recovery time between heart-wrenching, fear-generating moments. So I challenge you to slow down, take a beat, and prioritize your teams and your culture first. What they need most right now is to heal and restore. At the same time, what our organizations need is to rebuild and regain. But if we rush headlong down COVID mountain, hoping to rebuild, hoping to beat the competition, and we overlook our team's very real need for healing, we will pay a price. So how do intentional leaders prioritize well-being and relationships as you navigate down this slope? Experienced hikers know that when you head down a steep incline, you lengthen your hiking poles, you reach forward, and you lean into your supports more than ever. Lean on one another now, and allow others to lean on you by being available to listen. As well as leaning on one another now, many health systems are engaging professional counselors for their staff, for you to lean on. Next, it's important to take small, intentional steps. Remember, after climbing up COVID mountain, people are bone weary. Our teams need permission to pause, take in the view. They need time to reflect on all they've accomplished, all they've learned, and all that they've lost. They need to take small steps and conserve energy for their own recovery before they're asked to prioritize the financial and operational recovery of the organization. Spend time with each individual and really hear what they have to say about the experience and what they need right now. Be fully present for them. Appreciate the reality they faced every day for the past year and how that impacted the way they practice and feel today. I want to tell you a story that illustrates how leaders can take small steps that offer our team simple tools and support. Earlier in my career, in my role as a health system chief operating officer, I was visiting one of the hospitals in our system. When I arrived on the campus and parked my car, I saw a patient in the distance, in a hospital gown, in a wheelchair, making his way towards the main boulevard. Alone. He was making a break for freedom. It was an easy decision to go after him. I'm a nurse first, and it was clear that this wasn't going to end well for the patient or the hospital. When I reached the man, I introduced myself. He told me his name was Elvie, and I asked him where he was headed. He said he was going in search of a cigarette, and then he was going home. He didn't want to be in the hospital, and he assured me I wouldn't want to either. We talked for a while on the sidewalk, in the sunshine, and Elvie told me about what had landed him in the hospital with liver failure. In my years as a nurse, I cared for many patients, and on a busy day with 4 or 5 other patients, I know it can be frustrating and exhausting. But as an executive, I didn't have any patients to care for that day. I didn't have treatments and procedures and time-sensitive medications to administer, and I hadn't just worked back-to-back 12-hour shifts. That's not the reality for our frontline staff who deal with life and death pressures in real time. Beeping monitors, ceaseless calls from doctors and patients, limited staffing, and stretched supplies. The pressures leaders face are different, no more or less real than the pressures our teams face, but as leaders, we need to be aware enough to attend to our own well-being so we have the resilience required to attend to theirs. So I was well aware that it was easier for me to focus on Elvie in the sunshine and give him my undivided attention. I told him how much we wanted to take care of him, give him a warm bed, good food, the medicines he needed, and just a little bit of TLC. I asked what it would take for me to convince him to go back to his room. $5, he said. We struck a deal and headed back inside. I rested my hands on his shoulders as we waited for the elevator, and on the ride upstairs we talked and we became friends. I returned him to his room. He'd been gone for more than 30 minutes, and his nurse, the house staff, security, they'd all been frantically searching for him. They greeted him with relief, compassion, concern, and genuine affection. I'm sure they were frustrated and anxious at having physically lost a patient that day. But Elvie didn't know that. They made him feel cared for, cared about, and welcome. And it occurred to me, if they could handle this interruption in the midst of their busy day and make a lost patient feel cared for and cared about, how much easier for us as leaders to do that for our staff, make them feel valued and supported even on our busiest days. As I got him settled back into his bed, I introduced myself to his physician and nurse, who, as you can imagine, were overjoyed that their boss's boss had just returned their eloping patient. On their faces, I saw a mixture of relief, embarrassment, and concern about what I might think about their care. I thanked Elvie for giving me the opportunity to help him that day. I asked if there was anything more I could do for him. He held out his hand. $5, he said. Later, I talked to the care team and I asked if there was anything I could do for them, anything at all, to make their jobs easier. I explained that I understood the challenges of caring for patients, and I thanked them for the privilege of helping them. One courageous nurse told me that I had the authority to give Elvie $5 to get him to come back. But that wasn't her reality. That experience gave me the opportunity to connect with staff and to share in their challenges, to experience the issues they deal with and support them in their work. And it reminded me that staff experience frustration and barriers every day that they could easily resolve given the freedom, the tools, and our trust. It really made me think. I did another thing that day because sometimes the most important thing, the only thing a leader can do, is to simply acknowledge the challenges our teams face, share our heartfelt gratitude. So I sent personal thank you notes to each member of the team who had searched for Alvy for 30 anxious minutes. I explained how I was able to experience joy in that patient connection because I wasn't also caring for several other patients, and how much I appreciated that in spite of the demands on their time and their emotions, they extended an extra measure of care and compassion and respect to Alvy. And I know now that those notes landed with an intense mixture of gratitude and relief, because much later, one of the nurses who received a card from me that day reached out. She told me how that note had encouraged her, how she kept my card so she could pull it out occasionally to read at the end of a tough day, and how she frequently used the trust fund we had established that allowed staff to resolve a patient issue or connect with a stressed colleague. No questions asked. During COVID, we've had a lot of tough days. For our frontline teams working with critically ill patients, the pressures have been right in front of them. Beeping alarms, frustrated physicians, families separated and only able to connect at the end of a phone. It's been urgent, constant, and immediate. For healthcare leaders, the pressures, they've been different, but just as relentless. You've juggled the 24/7 responsibility, or should I say the 24/365 responsibility for a situation that has no playbook. For both frontline staff and healthcare leaders, all these experiences have stacked up one by one by one. So in our rush to address the very real financial issues impacting our industry, we can't lose sight of the reality that we and our teams have experienced a lot of high-stakes decision-making, deep emotional pain, much suffering, and genuine fear. No one has had time for decompression and restoration until now. As we navigate our way down COVID mountain, intentional leaders can create new norms. So I challenge you, come up with unconventional indicators to measure your team's healing and restoration. Has everyone had an opportunity to define and do the one thing that they feel would be restorative for them? Have the visual reminders of the pandemic largely been removed? Have lost team members been honored? Ask frontline caregivers for their ideas about milestones for recovery. The most important thing is that you initiate the conversation. Listen, track their well-being and yours. And for those of you who've done these things and understand your responsibility to put people, not issues, first, bravo. It's time to stop. Pause. Take a breath and take in the view. We need to engage in relationships that are about healing, well-being, and recovery. The truth is, after climbing COVID mountain, we're not immediately going back to normal. We've been transformed. And now it's time to intentionally create a new and better normal together, a new normal steeped in well-being and built on healthy relationships. The question now is, how do we lead well and carry on? How do we learn from the transformative experience we've all lived through? And how do intentional leaders like you forge a vision, find the right pace, and help our teams take the next steps? We attend to the needs of our team members first, and we plan for the needs of the organization's recovery second. The financial challenges to our industry are real, and they must be addressed. But better to address them with healthy, engaged staff who feel cared for and cared about. Leading well is about well-being, relationships, and intentionality. Remember, you've got this.